This is these are the legs of a 44-year-old patient who's had chronic venous insufficiency dating back to 1991, when he was essentially in his mid-20s. He developed a venous stasis ulceration in the leg, and since then has had at least 10 episodes of venous stasis ulceration. This was treated locally at wound care facilities or by a physician and by himself. He was recommended vein stripping at that time by his physician in Florida, and he did not follow through with the recommendation because obviously it was a procedure that did not have a good reputation because it has a lot of associated morbidity with it, a lot of downtime. So you can see that the right leg is much better than the left, but you will see areas of hyper and hypopigmentation. Hyperpigmentation here, hypopigmentation here, obviously where he's had ulcers that healed. And the leatheriness of the skin, it's very soft and supple up here at the calf, very hard and leathery here, especially in these areas where the skin is very thickened, leathery, and glossy in color. Right here it's very hard, right here it's very supple. So this is all consistent with lipodermatosclerosis, meaning that lipo is the fat, derm is skin, so it's thickening of the skin and the fatty tissues, and that's what sclerosis means. And on this side you can see much earlier changes of lipodermatosclerosis, and the hardness or leatheriness is localized to this area. But classically these changes occur in the gaiter areas, G-A-I-T, or gaiter areas of the legs, which is a hallmark of chronic venous insufficiency, and also this type of ankle flaring of spider and reticular veins. You can see more of it here in the patient's ankle on the middle or inside aspect, medial aspect, going into the arch of the foot. So we did a series of procedures on this gentleman, including treating venous insufficiency at the level of the thigh with an endovenous ablation procedure, and also multiple perforator veins that were ablated with EVLT technology. And there is subtle but ongoing resolution of the hemosiderosis, and I've told him that this would take, and this can take, more than a year for it to lighten up and to continue to lighten up with the topical application of different types of creams and oral products, and also the tincture of time following treatment of venous insufficiency. The reason venous insufficiency does that is that high venous pressures allow microvasculature to break down and the hemoglobin deposit underneath the skin, and in the process of healing, the iron in the hemoglobin molecule oxidizes, and then you see this brown rusty color. So it's literally like rust that you see in your bumper of your car. So this is, however, on the skin. So there are different types of pigmentary deposition in the skin. It would take several cycles of skin growth to get rid of this discoloration. So this patient is improving slowly and in a very subtle way. Most of the time patients don't notice the changes themselves because they look at their legs every day. But we have, as physicians, since we see them every 3 to 6 months, we can see these subtle changes, and it is important also once in a while to take pictures to remind the patients that they've come very far. This is Dr. Karamanoukian of veinsveins.com, showing images of lipodermatosclerosis in a patient with treated venous insufficiency.